Is bladder leakage normal? Are Kegels exercises really the gold standard? And what exactly is your pelvic floor doing for you every day, whether you're pregnant, postnatal, or neither? In this eye-opening episode of the Crackin Backs Podcast, we sit down with Susan Winograd, a physical therapist, a pioneering pelvic floor physical therapist who turned one painful moment during her own pregnancy into a mission that has helped thousands reclaim their health, strength, and dignity. With over 25 years of clinical experience, Susan breaks down what the pelvic floor actually does, why it's essential to understand its 5 key functions, and why ignoring these common symptoms like leakage, low back pain, or core weakness could be your body's version of flashing the check engine light. But it doesn't really stop there. Susan challenges outdated advice and explains why Kegels exercises aren't a one-size-fits-all, revealing powerful, science-backed alternatives, techniques that most people, and even doctors, don't know about. You'll also learn about her revolutionary 5 pillars of pelvic floor health and which pillar is most commonly neglected. We also tackle the myth that pelvic floor issues are just a women's thing, quite frankly, and explore how better training providers can close the gap and be more careful about who's really suffering in silence, men included. Enjoy the show. Well, good day, Susan Winograd. It is great to have you on. We're going to cover a very interesting subject today. Welcome to the show.
Thank you for having me.
Oh, very much so. We've heard some fun things that we have in store for you that we're going to talk about pelvic floor today. Pelvic what? Yes, pelvic floor. Now, this is an obscure body part because most people don't talk about this type of thing, but I know you have braved the conversation and have some really cool ideas for people that have different symptoms that, I remember, no kidding, 30 years ago, a woman came in to my office that was a runner, and she would just say by the second or third mile leak all over her pig. Can't get to a bathroom fast enough. So welcome to the show. Can't wait for you to address stuff like that.
Thank you. I'm so excited to be here, and I know most people don't talk about it, but I talk about it all day.
Well, let's just hope that they don't do like they do to Dr. Terry and I in a grocery store. Say, hey, you know what? Can you check I go, we're in the middle of the produce section.
I have a better one for you. I was at a wedding a couple weeks ago.
On.
A woman ran over to me and said, I just peed myself.
No. Oh, my God.
I was like, okay, see you on Monday in my office. What am I supposed to do here?
Oh, my gosh. What a great way to start the show.
That actually happens to me pretty often.
Wow. Well,
and I thought going, I have a headache. Can you help me with the headache? Was bad.
Yeah. That's become boring.
Right.
And I'm sure there are more symptoms that people come up with.
We're going to get really exciting. Maybe shoulders.
Very good.
All right.
Well, I just want Dr. Terry to know that Susan is located in Florida. Thank you very much.
I know. I already saw that.
I just want you to know. Because, there's this East and West Coast rivalry that we have all the time.
Well, what I'm understanding is only people in Florida pee in their pants at weddings, so I'm okay with that.
Only people in Florida talk about it.
There you go. That's right. Good job, Susan. Oh, man. So Susan, let's get down to the nitty. Well, we already started getting down to the nitty gritty, but let's get. You turned that moment of pain in pregnancy into your mission. Like, how did that all start for you? Like, was it a personal thing? I mean, go with it.
Well, I had really, really difficult pregnancies, and during one of my pregnancies, it was my third one. I'll never forget. Sometimes in your life you don't forget a moment. You remember the smell. You remember the lighting. I was in my third trimester with my third child. I had not felt well the whole time. And I told my husband, I'm like, you know what? I need to like air my brain out. I'm going to go to the mall and just kind of like walk around like aimlessly. So I went to the mall. I'll never forget. I was on the second floor in front of a Banana Republic, and I got a sharp shooting pain, and I could not walk. And I remember thinking, I called my husband. I'm like, I can't move. I'm in so much pain. And I remember my only concern was like, how am I going to get back to the car? So my husband, like, kind of calmed me down. He's a physician. He calmed me down. I got back to the car. I went home, and what do you think the first thing I did was? I called the doctor. I called my OB, and she said, you know what, come on in. And I went to the OB, and I said, I'm not feeling well. I'm in a lot of pain. This thing happened to me in the mall. And she looked at me. She's like, "Oh, honey, pain during pregnancy is normal. We'll take care of it after you have the baby." And mind you, I worked in a hospital at that point. I'm sorry, that was my third one. I worked in an orthopedic outpatient clinic at that point. I'm a physical therapist. I don't have a desk job. And I had planned to work till the end of my pregnancy. So I looked at her, I'm like, there's got to be something. I'm like, this is not normal. And she's like, honey, don't worry about it. You'll be fine. And it was like at that moment where I was like, this is not okay. And I think that the interesting thing about my career, I've been a physical therapist for 30 years, but at every point in my life, something similar to that happened, which led me to expand the next phase in my career. So for example, I'm 52 years old. I am in perimenopause. I don't know how graphic you can get.
Yeah, you can get graphic.
You can get real graphic, damn it.
So I said, I was perimenopausal. I was not feeling well. I felt like I had brain fog. I was tired. I was getting a lot of anxiety. So I went to the doctor, and she really did not know, my GYN really didn't know much about hormones or hormone therapy. And she said, you know what, it sounds like you have low libido, low drive, low energy. Here's some testosterone cream. Put it on your perineum and you'll be fine. I'm like, you want me to put it where? Isn't that going to make like everything down there grow in proportions that's not normal? And she was like, and then she looked at me and said, are you really going to complain about that now?
Really?
So you can't make this up. Like, no. I hear these stories all day long, but this happened to me. I have clients who have said their doctors told them to see a psychiatrist. So at that point in my perimenopausal life, I became obsessed with all things hormone balance. And I learned a ton. And I learned that maybe that's not the best place for testosterone. There are other ways to do it. And, women need testosterone as much as men. They really do. But women have to be educated. And men, we see men too. People need to be educated. You know what you don't, you know what you don't know, but you don't know what you don't know. Right. And my mission is to spread awareness on you don't know what you don't know. I want people to know that, all of this, so they could know just because it's common doesn't mean it's normal. It's not normal. And if you feel something, say something. And if you feel something, chances are that you can do something about it. And that's really, really been my mission and my passion throughout my career is helping people to be educated so they can have effective communication with their healthcare providers.
I think it's fascinating, the evolution of healthcare and how dramatic it's been. It wasn't too long ago that Dr. Terry and I would hear from, our patients, oh yeah, the doctor told me that I don't need vitamins. I'm on a good diet. Well, good diet in America is not that good anymore. So the evolution has changed. I love that we're talking about a subject that's been so remote and that could give answers to people. So you talk about, well, let's actually tell some of the listening audience that is not aware, what is the pelvic floor? What is it? And give us a little feedback on what the functions of it are.
How much time do we have?
We got all sorts of time.
I can talk about this for hours. So this is basic anatomy, which applies to men and women. Basic anatomy that everybody should know. I'm going to just grab my pelvis here for a minute because I always have to.
I'm grabbing my pelvis right now.
Yeah. So, the pelvic floor muscles are a group of muscles that lay at the base of the pelvis. So Dr. Terry or Dr. Barron, if I were looking at you from the head down, the pelvic floor muscles would look like a bowl shape, a dome shape, a hammock shaped group of muscles, and they go from the pubic bone all the way back to the tailbone and from one side of the hip to the other. Now, it is so fascinating because it's so much more complex than people think. There are 3 layers of pelvic floor muscles. Each layer has 3 muscles in it. And then we're talking about left and right. So it's pretty complex. Its functions, we call them the 5 S's, is sphincteric, because there's a closure mechanism. So we're not peeing and pooping all over the floor, right? There's a sexual component for sexual appreciation. The first layer of pelvic floor muscles is the external genitalia. So I can ascertain a lot by what's going on. Not only the penis and the testicles are not part of the pelvic floor, but there are a lot of attachments. There's a muscle in males called the bulbospongiosus that's responsible for helping ejaculation. There are a lot of muscles in the women that attach to the clitoris and the perineal body. So sphincteric, sexual, supportive, because the pelvic organs sit right on top of the pelvic floor muscles. Stability, the pelvic floor muscles are part of our deep core system, which is a separate podcast that we can talk about. And then there's sump pump. There's a lymphatic component because the pelvic floor muscles, it's skeletal muscle. So as those muscles contract and relax, it helps to help lymphatic fluid move throughout our system. So it's a pretty damn important muscle group that it's like one of those muscle groups that do everything, but is very under-recognized for everything.
Hey, Suze, what can go wrong? What are the variety of symptoms that somebody can come to you with?
Yeah,
with dysfunction.
I call that. So that was the 5 S's. Now we're going to talk about the 4 P's. Okay?
4 P's.
Peeing, pooping, pain, and pressure.
Nice.
All right? Got it?
Love
So
it.
urination, leaking. If you're leaking, if you feel like you can't fully evacuate, if you have urgency, if you have frequency, if you have hesitancy. For women, if you're getting a lot of lower urinary tract symptoms, anything bladder related, any involuntary loss of urine, having to go to the bathroom but not being able to get there in time, that's your body telling you should pay attention to the pelvic floor. Let's go on to the second P, pooping, constipation, incomplete evacuation. Incomplete evacuation is probably one of the more common things I see where people say, I feel like I'm pooping all day. I start, a little pebble comes out, I can't get it out, and I just seem to be busy with the bathroom all day. So constipation, incomplete evacuation, fecal urgency, inability to hold back wind. If you're in a crowded elevator and you got to pass gas and you can't hold it in, that's a problem. That's your pelvic floor saying either get out of the elevator or visit the pelvic floor therapist.
Or that actually becomes a problem for the people in the elevator.
Correct. Correct.
Awesome.
So anything bowel related, sexual, pain with sex, decreased sexual appreciation, And pain with sex goes for men and women. We treat a lot of men with sexual pain. Um, Inability to reach climax, anything sexually related, inability to achieve penetration for women. Those are all pelvic floor issues.
Interesting.
And then there's pressure. So feeling like something's falling out, feeling like you have a golf ball sitting on your rectum. Some men feel that's usually like a pudendal nerve symptom. Feeling like you have a tampon falling out, feeling like you have a lot of pressure in the perineum. For women, a lot of women say, I feel like I have a tampon that's half in and half out. Those are sort of the major things. And then we started talking about pain with sexual, but there's pelvic pain. The tricky thing with pelvic floor pain is that you guys know this. Sometimes the origin of the pain is at a distant location from where the person actually feels the pain. So, for example, we get a lot of men that have pain on the tip of their penis. A lot of times that's referred pain. The psoas could refer pain to, the genital area. So pain in the low back, pain in your coccyx, pain in bra line pain, hip pain, groin pain, those could all be indications that something is going on with your pelvic floor. And really, what we do is we look at the root cause, right? We don't want to just treat symptoms and put a Band-Aid on it. We want to identify what's causing the pain. Does that answer your question?
In a big way, yeah, in more ways than one. I remember studying many years ago about prolapsed uterus.
Mm-hmm.
Now that's after the fact, obviously, and there was always that device, that little ring that they would put up into the uterus, right? A pessary, right? You're talking about the ability to do things before that actually happens, yes?
Mm-hmm. Yes. So, for example, pelvic organ prolapse, a risk factor for pelvic organ prolapse is chronic constipation. Constantly bearing down over and over again can cause a rectal prolapse. I years ago I had a lady and she was taking a yoga class in downward facing dog, and her bladder prolapsed. That was a intra-abdominal pressure management issue. So when we think about prolapse, we think about it in terms of whole body. Pelvic organ prolapse, is a weakening of the connective tissue in the vaginal walls. Men can get a form of rectal prolapse also. It's not as common, but pelvic organ prolapse, when we look at it as a postural control issue, a pressure management issue, and a pelvic floor issue. So that's why it's so important for people to know how to use their core, to know how to generate support from the inside out, to know that chronic constipation is a risk factor and can contribute to pelvic organ prolapse, and that alignment may also play a role. I'm particularly passionate about women during pregnancy having pelvic floor therapy checkups the way we do it in a whole body approach, because their bodies are changing so quickly, their posture is changing so quickly, there's so much pressure on their pelvic floor, and by simple education, we can help them learn how to manage pressure throughout their pregnancy, optimize their alignment as their center of mass is changing, and also that by simply preventing constipation can help also. So I wish, and the reason why I speak all the time and do podcasts and how to podcast is because I typically treat people once they have prolapsed. And sometimes it's not avoidable. There are other risk factors, but I very often find that it either could have been preventable or the degree to which they're presenting with could have been mitigated.
Do people that have hemorrhoids, is that like an early warning sign because of weak connective tissue before, like Because I don't think I remember hearing ever about rectal prolapse.
Yeah, so it's very interesting that you asked me that because I had a meeting with a good group of colorectal surgeons, and one of them said, "Well, what do you do?" And I started telling them what I do. And then I said, "We can also help people manage and prevent hemorrhoids." And he started literally like laughing at me. He's like, "I'm done here. You gotta be kidding me." It was terrible. And the answer to that is that people usually get hemorrhoids when there's a lot of pressure down in the pelvic floor, they're straining a lot, or there's a lot of tension in the pelvic floor. So it's a varicose vein, right? So if you ask a pelvic floor physical therapist, I believe we will all tell you there's so much we can do to help hemorrhoids and potentially, maybe even prevent them. If you ask a colorectal surgeon, they may give you a different answer.
Hey, Susan, I'm going to interrupt that for a second. I, when I worked with a hockey team, a very well-known hockey team, there was like 2 or 3 of our players at the pro level that had hemorrhoids.
Mm-hmm.
It's very interesting that Dr. Spencer brought that up because you would think these pro athletes were very strong in their core and their lower body. What would be your answer to why would these pro hockey players on skates doing that getting hemorrhoids?
So the answer to that question is I'm going to give you one hypothesis that could be, but
Yeah.
obviously there's a lot of things that can contribute to hemorrhoids. They could be very constipated and just kind of like bearing out to evacuate, stool over time. Usually hemorrhoids is not something that happens once. It happens when you repeat straining over a period of time. So, it could also be, and I know professional athletes are strong. I've treated many professional athletes, and number one is that doesn't mean that they don't have tension in the pelvic floor. They may be strong globally. They're so good at compensating. An athlete, you're right, is strong all over, so they may have some tension in their pelvic floor that they're able to compensate with other muscles in terms of stability. What I see a lot is that when people are young, they can compensate and compensate and compensate. And then you get to a certain age. I mean, there's so much we could do to optimize our bodies, but I particularly find this in women that are in perimenopause and menopause, where there is a drastic change in hormone levels, that things that they've been compensating for at a younger age start manifesting as they get older. So, I think the bottom line is these athletes are young, they're globally strong. They may be able to compensate, or it may be a constipation issue. It may be an intra-abdominal pressure management issue. But just because you're strong doesn't mean that you're constantly managing pressure during activities. So someone like that may be breath holding during things that require a lot of pressure. And when you breath hold, I always think of breath holding as holding on to pressure. Well, the pressure has to go somewhere, right? So when you constantly hold your breath and bear down, the pressure's got to go somewhere, and usually it goes downward. So there's many reasons why they could have hemorrhoids, but those are just a few hypotheses. I don't know.
Anybody listening to this show right now has to go to our YouTube and watch what just happened. Yeah. So I'm not
you all.
Oh yeah, I'm not gonna describe it because I want people to now have to go to YouTube and just watch what just happened. Yeah. That was hilarious. The reason I even brought that up, I just want the audience already to not think of pelvic floor as a women's pregnancy thing or an old man thing. I want people to start thinking it's just like we've had talks over the last 2 years about you have to think below the knee for everything above the knee to be healthy. So I want people to start thinking globally instead of just myopically, and I thank you for that.
Yeah. Terry, let me ask you a question.
Shoot.
You do more like motocross and specialized. I'm curious about what Susan has to say about the bike seat and, long distance riders and, guys that have you ever had anybody complain about,
Well, you just have motocross and cycling are two different sports. So motocross, they hardly ever sit on the seat. So you would be talking about cycling and like Tour de France stuff, and even mountain biking. They hardly ever sit on the seat. So that's a little different. So that would be a pudendal nerve issue for cycling. Would be long distance cyclists, road cyclists, not anything else. Just to clarify that.
Yeah.
Suze, how would you fix that?
We do being proactive. So I'm very I believe we shouldn't tell people not to do what they love, but we have to optimize the way that they do it. So for someone that sits on a bike all day, I would first of all optimize their seating, make sure their body mechanics are good, but also I really make sure that there's a lot of pressure up on the pelvic floor when you're sitting on a bike all day. I would probably give them some pelvic floor relaxation exercises to do consistently to try to make sure that they're getting that healthy contracting, but also lengthening of their pelvic floor. And maybe even checking in with a pelvic floor therapist to make sure that the tone of their pelvic floor is good, everything's sliding and gliding the way that it should. If they feel something, nip it in the bud. But always optimize. Know your body, know how to do your sports, and be proactive. Always balance out. If you're contracting all day, make sure that you're lengthening also throughout the day.
So because I always have heard strengthening the pelvic floor muscle, but this is the first time I've heard someone comment on relaxing them. How do you relax a pelvic floor muscle?
That's such a great question, and I'm so glad you brought it up because we have people that have tension in their pelvic floor that needs to be released as much as we have people who need to strengthen.
No kidding.
Yes, so I would say it's completely equal. So, yes, someone once told me this, and I don't know if it's true, but I think it's kind of funny. It was another pelvic floor therapist. They're like, where do you think like a type A personality came from? Where do you think we got that from? And I was like, I don't know. She's like, because they're tight asses. They hold tension.
I was waiting for that.
So, yeah. So I was like, oh, that's like really interesting. That kind of makes sense. But in answer to your question, there are many ways we could release the pelvic floor. One way is manually with massage. The best way is through the breath. The pelvic floor and the diaphragm work synergistically, okay? So we have the diaphragm up here. We have the pelvic floor down here, right? The deep core system is made up of 4 muscles. The diaphragm, the pelvic floor, the deepest abdominal muscles, and then the deepest back muscles. They act like almost like a hydraulic pump in our deep course in our body. Okay? The entire system is led by the breath. It's fascinating. When you inhale and your lungs fill with air, that growing volume of air in your lungs makes your diaphragm flatten and descend. In turn, your pelvic floor muscles will lengthen, broaden, and relax. You exhale, the pressure is released from your lungs, and everything shortens, recoils, and engages. So with every breath you take, your pelvic floor relaxes and engages, lengthens and shortens, broadens and recoils. So I am obsessed with the breath. I think you can manipulate every system in the body with the breath, depending on what kind of breath you use. But for the deep core system, for the pelvic floor, deep diaphragmatic breathing is the best way to release and maintain the healthy length tension relationship of the pelvic floor. Makes sense, right?
Yeah, very much so. Yeah. So it's interesting because my my girlfriend's a chiropractor, but she's up in Detroit, and she told me about one patient. She does dry needling.
Mm-hmm.
She told me about one patient that she did dry needling on the perineum.
Mm-hmm.
I go, for those who don't know what the perineum is, in a very crude way, in high school they used to call it the taint. It taint your ass and it taint your balls. So it's right in between that area.
Yeah.
And so she did it and successfully helped someone with some condition they came in with. But to do dry needling in that area, have you heard of this?
I do dry needling. Yeah, I've taken all the dry needling courses, so I think that speaks to. And when I took the course, I'm like, oh my god, like. But I think it really more speaks to the degree to which people are motivated to really get better. I don't needle the perineum really that much. I needle the obturator internus a lot. I needle the coccygeus. I needle the iliacus a lot. I needle the psoas a lot. But I think it really speaks to people really want to get better. They want to get back to their sport. They want to, really optimize their quality of life. And it's really, really effective.
Yeah, well, she helped that one person with the dry needling, and they referred a male and a female.
Yeah.
I mean, it all of a sudden became like an issue that people were talking about. It's fascinating.
It's so funny because since I started dry needling, I started getting athletes that are like, my lats need to be dry needled, and my rhomboids and my traps need to be. I'm like, you know what my specialty is, right? And they're like, yeah, let's forget about that. Let's stick to the waist stuff for me, but I need you. So I've had a couple of athletes that just heard about my dry needling and came to me for that, and it's amazing.
That is so funny. I love that.
Yeah.
Go ahead, Terry. Were you going to say something?
Well, it just makes so much more sense because when I first met Spencer, he was such a type A person, and then ever since he met Karen, he's so much more relaxed. And I thought for something else. Now I understand.
I swear she did not needle the perineum. I swear.
When Spencer comes to me, then he'll be like a Zen Buddhist.
Oh,
so
yeah.
I can really get him to relax.
Oh, absolutely. I mean, he's just been so trained in this last year and a half. So to answer so many questions, I'm just enjoying this so much. I gotta, while we're on this topic, I want to actually talk about. Everybody talks about when they think about pelvic floor, all I think about is Kegels, right? Mm-hmm. And people are going, oh, Kegels is so old school. I mean, but that's what only people really know. And I think OB still this day goes, just do your Kegels and you're fine.
Right.
Can you elaborate on that?
So I think that's so old school.
Yeah.
First of all, let's just start from the beginning, right? So many things I want to say on that, but
say it all.
Say we're just talking about Kegels, right? You can't just do Kegels. When I do a Kegel, I'm giving people a fit prescription. I'm giving them, function, timing, interval, intensity. There are slow twitch fibers and there are fast twitch fibers. So even when we do give people a Kegel program, we're giving them a very, very individualized program on how to do it. And we're making sure they do it right. Years ago, they did a study on how women did Kegels, and they found that 80% of women were doing it wrong. So I think to give people a blanket statement of doing Kegels is detrimental to their health. And number two, we all know that nothing lives in isolation. And when we're treating something, we can't treat it in isolation, especially with the pelvic floor, because it works synergistically with the transverse abdominis. It works synergistically with the diaphragm. So when we see someone, we're making sure that each core component is working optimally individually, but we're also making sure that it's functioning optimally in coordination with each other. And then you want to take that to the next level and make sure that they're using their pelvic floor and their Kegels functionally in their gross motor movements. So many people get pain, hip pain, groin pain, back pain, because they're really not using their pelvic floor or their core. They're compensating with many superficial muscles, and over time, that's just not sustainable. So we need to teach them how to use their core in a way that's going to support the demands of the task we're asking it to do. So it's so much more. I'm not even going to say it's complex, because that's what we do all day and people love it. I always tell people, I'm going to teach you to use your body in a way where you're not going to need to come to me. You're going to know exactly how to use your body in a way so you can do any movement. And it's so liberating. People feel so much lighter. They feel so much more supported. And I think the most common comment I get is, how did no one ever tell me about this?
Right.
Like, how did I not know about this?
You know what, Susan? I love this, by the way, and thank you for that. I have, in the last week preparing for this, I've had two people, one male with prostate cancer that just got done, and a female, and both of them were jumping either with grandkids or their kids, and they were leaking. And both of them were told, oh, that's just common the older you get. And I don't buy that. And then, oh, here, just do Kegels. Every time you're at a stoplight, just pretend you're stopping that urine flow. And then when the stoplight goes, you're done, and just do it every time. Can you just give some practical knowledge for somebody listening right now that has been told that, and what they can start doing right now before they can get to a specialist such as yourself?
Yeah. Well, first of all, I want to just say that leaking at any age is not normal. It's common, but it's not normal. I want to tell you a really quick story from my practice. That's my favorite story of all time. I had this 80-year-old lady who called me, and she was hysterical. She's like, hello, is this Susan Winograd? I tell this story all the time. So if you've listened to other episodes of the podcast, you've probably heard it or been to one of my events. I'm like, yeah,
by the way, you're not originally from Florida, are you?
Can you tell my stepmom? No, I'm a transplant, but my husband is born and raised Floridian. So
Wow. There are very few of those.
I have a stake in the state. But she called and she was like, oh, this is Susan Winograd. You know what? I want to tell you what happened to me. She's like, I'm a housekeeper. I'm 80 years old. And last week I started pushing furniture to clean and I started leaking. So Susan, I said, this is not happening. I went to my gynecologist and I told her what happened. And I said, what are we going to do about it? And her gynecologist looked at her and said, you're 80 years old. You should retire. And she said, Susan, you know what I said? I looked at her and I said, I didn't ask you for professional advice. And she walked out and she's like, can you help me? I was like, you're my kind of girl. Come on in. I saw her like 3 times. Her leaking wasn't even a pelvic floor issue, really. It was a pressure management issue. She was like breath holding and not using her core right. She loved her job. She loved the people she worked with. She didn't want to retire. She wanted to get better. So I tell this story because we cannot dismiss people. When people come to us for help, when they're having pain with sex, don't just tell them to have a glass of wine and relax. If people are leaking, that happens all the time. People are leaking, don't tell them it's normal. But what I would say is learn a little bit about natural, bladder mechanics. Make sure that you're hydrated. Make sure that you maybe start avoiding bladder irritants, which would be caffeine, alcohol, carbonated beverages, acidic beverages. Those could really exacerbate leaking and irritate the lining of your bladder. And I would honestly say go to a pelvic floor therapist, because you really, really could be leaking because you're weak, and you could also be leaking because you're too tight. We know that a tight muscle is a weak muscle. So I have as many people that leak because they have way too much tension in their pelvic floor as women that are weak and tight, about the same. And also, a lot of women, you want to avoid two main bad habits. You want to avoid peeing just in case, because that can get your bladder used to giving you the urge at a much lower volume. I'm going to pee just because I'm going to be on a podcast episode. I'm going to CVS so I can pee. So if you're constantly doing that, you are training your bladder to give you an urge at a much lower volume. On the flip side, you want to avoid camel bladder. Nurses, shift workers, teachers, pharmacists. I've had all of those professions telling me that they cannot go to the bathroom for 12 hours. They're on a shift, they're in the classroom, they're in, I had a male delivery woman who came to me. She was holding her bladder for 12 hours because she didn't want to go while she was delivering mail. That can overstretch the lining of your bladder and decrease that sensitivity to urge. So just, honor a strong urge, learn about bladder mechanics, and make sure you're hydrated. When people leak, their natural inclination is to stop hydrating because they don't want to pee, but it's actually the reverse. A concentrated urine is very irritating to the lining of the bladder and will really give you more urgency and frequency. So keep hydrating, but make sure you see a pelvic floor therapist so that you could really resolve it for good.
So besides breath work, what's some exercises they can do to help with their pelvic floor besides Kegels if they're doing it wrong?
So with us, what we do a lot is, first of all, I ask people what they like doing. So if they're a yogi, I'll do a lot of pelvic floor engagement and strengthening in coordination with yoga positions. If someone is like HIIT or weightlifting, I will give them strength training exercises in coordination with their pelvic floor, because ultimately we want to make sure that they're not only using their pelvic floor while strengthening in isolation, but also in functional movements. For some people that need a little more neuromuscular education, we can do biofeedback. So with biofeedback, we actually either put an internal sensor in vaginally or rectally, or perianally, we could put electrodes. We attach them to a computer, and they can actually see on the screen themselves engaging the pelvic floor and lengthening their pelvic floor. So for people that have a difficult time with that neuromuscular connection, we can do that. We also have electric stim, we don't use that as frequently, but there are some situations where we do. It's almost like an NMES to help them recruit. But our treatments are very, very individualized. We don't have two people with the same plan of care.
Awesome. You talk about your 5 pillars of health to make the pelvic floor strong.
Mm-hmm.
What are those 5 pillars? Can you give us a little overview of that?
Yeah, so hydration is number one. Hydration is number one. Nutrition is really important. Movement is really, really, really important. We have a complete biopsychosocial approach. Is that what you were referring to? We have a complete biopsychosocial approach in our practice. So nervous system regulation is really, really important as well. And the last one I would say is like self-care and breath work.
Oh. And just to throw it out there, because we've been hitting around it a little bit, myth or truth? Pelvic floor issues are only women that are pregnant.
So I will dispute that by telling you that I started my career in reverse to most pelvic floor PTs. I started my career with men. I treated only men for the first year that I only saw pelvic health. a door opened for me. Someone who treated prostate cancer approached me and I was really interested. I ended up developing a pre-prostate surgical program for him. And then, I felt like I was missing out on the other half of the population, so I expanded. But men have pelvic floors just like women with the same issues that women do, and very similar anatomy, except for the external genitalia and, of course, the pelvic organs. But almost identical anatomy. So yeah, I one of the things that I'm proudest of is that we help men because there are so many women's health centers. There are not as many places for men to get pelvic floor treatments. And our male clients are amazing and they're so appreciative and they're so grateful. And one of the things I'm proudest of is that we help men as well.
Do you see young kids? Not young kids. Do you see younger generation?
We see younger adults. We don't see children. With children, there are pediatric pelvic floor PTs. We don't do pediatrics. With pediatrics, the largest component is really parent education when we're dealing with younger children, right? Because we don't do internal work on young children, and it's a lot of education for the parents.
Interesting.
But there are pelvic floor PTs. We don't do pediatrics in our practice.
I remember growing up and hearing about kids that would become constipated because they would hold it in because they had these anal fixations, and that was that could have been a psychological thing from home.
Right. Well, I think that comes a lot with kids. Like, I'm a pelvic floor PT, so like when my kids were younger, I'm like, if you gotta poop in school, it's okay. You have to go. You shouldn't hold it in all day. Right? I think a lot of times it comes plays into those situations where a lot of kids don't want to go in public bathrooms.
Yeah.
We have to educate our kids that it's okay, or even make certain accommodations for them if needed, if they really won't go. But we have to teach our kids when they have an urge to honor it. Is that what you were referring to?
That's a lot of what I mean, because those aren't muscular weaknesses, or those aren't physical thing. Those are more psychosocial aspects.
There can be times when a child may have a pelvic floor tension issue or a neuromuscular incoordination or dyssynergia issue. And again, there's a lot of breath work involved and a lot of education on the parent.
Speaking of education, what kind of education is available out there to PTs or doctors that are interested in engaging in this kind of this environment?
There's so much. I mean, I did most of my proper basic pelvic floor physical therapy proper education. I did most of it on Herman and Wallace, which is a pelvic health educational institute. The APTA has tons of courses. I mean, it's very readily available, but I don't think that's enough. I've taken, our practice has such a diversified skill set. I've done craniosacral work. I've done total body balancing with the D'Ambrosio Center. I did all the dry needling work. I did a myofascial technique that's, geared more toward infertility. I feel like we really have to treat the whole person. I've done several courses just on how to integrate a biopsychosocial approach. How do we approach people that have pain, but also have depression, anxiety, stress, catastrophization, worry, central sensitization? We have to address the nervous system. Otherwise, the body will never get better. So I think if you really, really, really want to help people resolve their symptoms and their issues for long-term health, you have to get all the basic pelvic health training and coursework down, but don't stop there because people need so much more.
It's good to hear. From that perspective, we're focused on just a area below the waist, and yet there's so many ramifications to it. Just kind of like when patients come to Dr. Terry, hey, can you just crack my spine? Well, I mean, there's so much more to find out about, you know.
Yeah. Yeah. Well, for example, urinary urgency is an autonomically mediated condition. That is a nervous system mediated condition. So we have to treat both. A lot of sexual function has a lot of nervous system component in it, right? We know that sexual appreciation is like this delicate symphony between the brain and the body. And they both have to work together in an optimal way in order to achieve climax or in order to have sexual appreciation. So we really have to like kind of broaden we have to have a global view of how we look at people.
You mentioned earlier, like psychosocial, you know, I mean, there's also, you know, I mean, over the years, I've always been fascinated. You know, a patient will come in and they have low back pain and they'll talk about it. And then, you know, it's so basic, you know, there was not a complex situation, but if you listen closely, you can hear that they have a problem with their spouse. They're almost looking for an excuse or a reason. Do you ever notice, you know, things that, you know, situations where maybe you should go to a psychotherapist or a family therapist or a relationship therapist?
Yeah, excuse me. There are a lot of times when I see people where I have a great network of psychotherapists because I can help them with their pain. I can also help them with a biopsychosocial approach within the scope of my practice. But I cannot help them process, trauma. I cannot help them process emotions. So there are a lot of times where I say, I really, really think you're going to get the best results if you work with me and a psychotherapist at the same time. And there have been a lot of times where I say, I really don't feel comfortable working with you unless we work with a psychotherapist at the same time. A lot of stuff comes up with pelvic floor. We bury a lot of emotion there. And a lot of times people have a, somato-emotional release in therapy. And, I love that, but I can't help them process that. I can help them with depression by giving them cardio exercises. I can help them with anxiety by giving them certain kind of grounding and nervous system regulation. But if I feel that that stuff is stemming from emotions that need to be processed, that's not in my wheelhouse.
I know our viewers or our audience is dying for me to ask you, has anybody peed on you?
No,
No.
never.
We mean our audience is dying to know that.
No, it never happened.
I don't think anyone was.
That question was not even in my head.
Not only that, Dr. Spencer, but no one's ever asked me that. You're the first one.
Of course he is. That's because he has dry needling in his perineum right now.
I did not get that.
Well,
you know what? I think everyone's wondering now whether anyone's peed on you.
No, but I have people fart on me all the time. So
all right, that's it. We're done.
Dr. Terry, don't even make believe like that never happened to you. Liar! Speaking of which, I had a professor from a university, a woman. She had abdominal surgery, and she told me, she goes, "Listen, be gentle. When you adjust the low back. Let me tell you, if you've ever, Susan, if you've ever had an adjustment from a chiropractor in the low back, that chiropractor's way down there, She blew a fart so bad that it practically burned my eyebrow up. No, kidding. But it was so bad, and she got so embarrassed that the only thing I could say was, listen, if you think that's bad, when you see my bill, you're going to shit. No.
That's funny.
So
you got to laugh sometimes, right?
It got her to laugh, and we moved on. But yeah, people pass gas all the time.
You got to laugh. Next
time a patient passes gas, I'm sending him to you, because that means they have a weak pelvic floor.
Yes, and I can send them a bill that's going to make them shit.
Right on. Wow, we got a good comedy show going on here.
Good, right?
So, needless to say, Suze, you this is a specialty, and it is a specialty that has lots of legs to it. And I really think that, one of the things I was going to ask earlier is it, can a doc, what if somebody goes to their doctor or their, and asks, you're going to get that answer, that age old answer, the Kegels, but they really need to go to somebody who's so comprehensive that has many tools in their belt.
Right.
I would imagine you would agree, because you've really made it a career in that area, and a very specialized area.
Yeah, a lot of people think that a lot of our practice is like manual work, like internal, vaginal, or rectal work, and that's really a tiny part of it. We have to be really good at orthopedics. We have to be really good at treating the nervous system. We have to be really great myofascial therapists. And also we have to be really great at finding the driver. There have been many times when people have come to me with pelvic pain and I end up treating their foot or their ribs, and a lot. And so I feel like, you really, really have to go to someone who's going to have your long-term health in mind. Don't just fix the problem for now. Let's resolve this for good.
Susan, you've been doing this for 3 decades. I mean, that's quite a bit of time. What is it that drives you to achieve even higher education and more comprehensive? What as a healer, as an educator, what is moving you to this level?
That's a great question. Well, first of all, I've been a therapist for 30 years. I've only done pelvic floor for 10 years. So I think I just am addicted to people's reactions when they feel good. It's just it's like the best feeling in the world. I think that it's fascinating. I every step I turn, and I just feel like there's more to learn, and it's interesting. And I love it. I truly feel like this is my purpose. So when you're living your purpose, why would you want to, not strive to be better and better?
That's fantastic. Well, we're nearing the end, but we always have to include our rapid fire questions in our show. There's 5 of them. I'm not sure if you're willing to handle it, but you got to be quick on quick on your feet. Rapid fire.
All right. The upper East Coast woman is coming out.
Yeah. Oh yeah. Did you see that? Yeah. Go with it. All right. I love it.
I'm ready.
All right, Susan. If you could wake up tomorrow and master any hobby or skill, no limits, what would you dive into?
Cooking.
Really?
I love cooking.
Really? All right. We're gonna film a show at her house and have lunch after dinner.
I'm a really good cook.
Oh,
awesome.
I'm a really good eater.
Yeah, me too. Oh, question number 2. If you were being sent into a deserted island for several years and you could choose only one book to bring with you, what would it be?
The Bible.
Ooh, good. How come nobody else has answered that way? That would make all the sense in the world. Very good. All right, so far so good. Question number 3. Is she great at these answers? She's
killing it.
Yeah. Question number 3. When you're having a rough day, what's your go-to pick-me-up routine?
Give my husband a hug.
Oh, that was great, right?
I have breath work and I have go-to strategies, but nothing makes me feel better like a hug from my husband.
I love it.
I love that.
She's great.
I'm all melting over here now.
Yeah.
Celebrating our 30th wedding anniversary.
Oh, we got our 29th on Saturday.
Oh,
yeah, thanks.
That's so cool, you guys. Good for you. Question number 4. Complete this. The one thing I would tell every new parent about pelvic health is...
Be proactive.
Wow. Is she not the best at the?
She's probably the best. Really? Yeah, absolutely.
Yeah. Because
they're not. Come on, you got to do better.
You can't imagine.
These are easy peasy.
You can't imagine the answers we get. Anyway, we'll go on. Question number 5, last one. What is the one thing that always makes you laugh?
My grandchildren.
That's great. Especially when they laugh, right? Oh, that was great. Suze, thank you so much. Susan Winograd, this was
a lot of fun.
Fantastic show. It's so unique and it's very, very informative. And, I'm sure our audience is going to be looking into the bottom half of their body a little more closer. Thank you, Suze.
Thank you.
Thank you for listening to today's episode of the Crackin Backs Podcast. We hope you enjoyed it. Make sure you follow us on Instagram at Crackin Backs Podcast. Catch new episodes every Monday. See you next time.